People living with liver disease may have memory disturbance for a number of reasons. One is that the underlying cause of why they've got liver disease may also affect brain function. So people who have long-term excess alcohol consumption, that can also affect the brain function long-term and cause brain damage. People who are living with metabolic associated liver disease, so that's liver disease due to diabetes or obesity, for instance, can also have more widespread cardiovascular and cerebrovascular disease. That means vascular disease or blood vessel disease that affects brain function. So they may be things in the background that may be affecting brain function. But brain function may also be specifically affected in liver disease by the buildup of toxins or ammonia that gets to the liver and disturbs brain function. That may be very subtle, so it may be seen as just difficulty in doing normal day-to-day tasks such as a crossword, such as reading, even concentrating on a TV show or conversations around, may affect work performance, may affect driving and the concentration when you're driving, which is a big concern. It may affect just other day-to-day things and be very subtle. It may be something that you might notice or that a loved one might notice. In its more severe form, we call it overt hepatic encephalopathy. What that means is that really there are very clear signs of brain disturbance. So there may be confusion, there may be drowsiness, there may be disorientation or sort of getting lost around the house, not being able to find the way to the bathroom, going outside and getting lost in the street. If somebody is driving at that point, which they shouldn't be, but if they are, getting lost when they're out in the car or having an increased risk of having a car accident. In its most severe form again, people get so drowsy that they may be unable to be roused or woken, and that's really an emergency and that person needs to be in the hospital. So if somebody living with liver disease suddenly becomes confused or disorientated, there are a number of things that can be done. If it's something that's happened before and you're aware of it, then maybe an extra dose of lactulose syrup, which is probably there in the cupboard at home or on the table, an extra dose might help to settle things down, making sure that the bowels are being open. So if somebody's living with encephalopathy and they know they've had it before and their carers and loved ones are used to it, extra dose of lactulose every couple of hours may be enough just to turn things around. But if this is a new episode or it's not improving with more lactulose, then really it's a trigger for more medical care, and usually that will be in an emergency department in that situation. There's not much more you can do at home if somebody is getting more drowsy, sleepy, aggressive, disorientated, confused, etc.